13,000 codes here.
To define exactly what happened to the patient and why they're there. The federal government...
So they can be reimbursed.
So they'll be reimbursed by Medicare and Medicaid.
And why so many?
Well, the federal government thinks there needs to be more, because there's going to be now 140,000 of these codes for doctors to fill out, and they're very specific.
140,000.
Going from 13,000 to 140,000.
It's already horrible, tiny, fine print here.
And none of these codes help make a patient better or healthier. They're very expensive. Average, let's say a sole practitioner doctor, will cost the doctor $80,000 to implement the new federal code procedure. If you have a bigger practice, let's say there's 5 to 10 doctors, it's about $250,000 for the doctor to implement the federal government codes so that when patient comes in, the doctor can't check bitten by a dog anymore. You have to check bitten by a Dalmatian, a Doberman, a Pit Bull, a Chihuahua. You have to be very specific. If you mess up, if you make a mistake, or you do it on purpose, then you're in violation of federal law. You won't get reimbursed. You could be fined. So that's what the doctors have to look forward to.
And already under the existing codes, you have a code for if you're bitten by a duck. A slightly different code means you've been struck by a duck. Who cares?
Who cares? The duck doesn't care, and neither should the patient or the doctor. You want to treat the injury. That's the biggest concern.
Injured in a chicken coop, it's a code for that. Fall at an art gallery. And we asked Health and Human Services why so many, and they didn't get back to us.
Not surprising.
But from what I read, they say this will help them plan for the future. You ship information to another doctor, he knows if you walked into a pole or if you're a repeat pole walker into, and that might make a difference in how he treats you.
Maybe, maybe not. Does the federal government need to put all this detail in to just keep records at this great expense? And I don't believe they do.
It is unbelievable. This is the old book again, and the new one will be 5 or almost 10 times as big. They're not just stupid. They must have a reason for doing it. They don't want to just build empires, do they?
Well, they are regulators. And we have to understand that when regulators go to work every day, and they meet around, and I think these big oak tables and drink their lattes, they decide, who shall we regulate today? Why don't we regulate the medical industry a little more and make doctors and hospitals fill out these very specific codes that don't treat a patient but give us information about the patient? And that's what they do. Regulators regulate. That's what the law allows them to do.
Doctors are just meekly following these rules, right?
Yes, they are.
Doctors obey. You have to obey if you want to get paid.
If you want to get reimbursed or get paid or not be in violation of federal law, rather than expanding a practice and hiring a nurse or an associate or someone else on the medical staff, you hire someone to keep statistics for you so you can turn those into the federal government. And the federal government even shows online where you can take courses to know how to implement the new codes.
And give us some other examples. 9 different codes for being injured by a turkey?
That is correct. Whether you run into a turkey or the turkey runs into you, you're pecked by a turkey, or you're bitten by a turkey, there's a difference between being pecked and being bitten. So they have 9 codes for turkeys. They have about 5 codes for basketball. You hit by a basketball? Are you a second offender or third offender being hit by a basketball? Or do you have I don't know what the medical term is, a condition where you're always being hit by a basketball? So doctors have to figure this out, and they check that right, put the number in, the 10-digit number, and check that number to make sure that they have.
Yeah, the codes are even long. W6161XA. They don't memorize this stuff.
No, they have a code book. they're going to get one a lot bigger than that one. So they have to look it up in the code book under what? I don't know. Do you look under turkey, or do you look under what you run into, or basketball?
What would you have them do? You're king of all Congress.
I think what the regulators and regulations need to make some sense. So what is the purpose? What is the goal? Of course, doctors need to be accurate in their diagnosis, but do they need to go through this much detail to get information to the federal government? I don't think they do.
And just to be clear, this is not part of Obamacare. This was HIPAA passed under Bush. It's being enforced. The rules are being increased under Obamacare. But this is why we patients also have to fill out more forms when we go to the doctor.
That is correct. This is not a new thing. Just the new code. Code 10 is the new one. We've had nine revisions, expansions of this initial law. This is the 10th expansion, 10th code book. But maybe it has gone a little too far in treating the American sick patient by the doctor filling out the form.
The bureaucrats always want more. So thank you, Congressman Pohl, for bringing this to my attention. Coming up, doctors who don't hide the cost of health care behind government code.